how do we support an employee who has mentioned potential mental health challenges? I think the first thing that you would want to do is, quite frankly, to have a refresher or an understanding of the ADA, which is the Americans with Disabilities Act, and just identify, well, what are the responsibilities that I have as an employer? And then what are the potential landmines that I or my colleagues could get into if we say the wrong thing, have the wrong expectations, so on and so forth. So
Mhm.
if you haven't brushed up on that fine piece of reading, reach out to us because we take a look at it all the time. The other thing is, just there are so many new mental health offerings at the corporate or company level that you could even consider rolling out to your team. Because if one person has mentioned it, you could surely assume that maybe other people might be wrestling with mental health challenges as well. And
Mhm.
so being someone who can lean into providing support would be a great way to be an employer of choice. Now I'm gonna give all the nice ideas, the good ideas. Summer, get in the trenches and help this person because there's a performance issue here, and that's the part I wanna hear you shed light on.
Certainly. I think first and foremost, I always advise that managers are not the first one to bring up any sort of medical matter. So, whether that's a medication or some sort of illness or injury, it's really important that we are not the ones prompting that conversation. Now, of course, there may be extreme exceptions, but I'm just saying in this example, I would not go to the team member and say, "Hey, it appears that like your medication is really slowing you down," and start a conversation that way, because certainly we know that's not going to go well. Now, even if that same conversation was handled a little bit more delicately, it's definitely putting the company at risk to go into a performance conversation leading with some sort of condition that may be protected by the ADA. So, the way that I recommend that these conversations start is based solely on performance, because at the end of the day, that is the piece that we are looking to tackle. Yes, we care about the team member, and yes, we want to help them. So, I like to tackle that conversation talking about where I've seen the performance has been lacking, and then ask some very open ended questions, such as, is there anything that the company can help you with to assist you in meeting these expectations? So, the goal there is if there are specifics in any area that the team member can think of, they're going to bring it up in that conversation. And so if an employee says something to the effect of, "Gosh, you know what? I could really use just a couple of days off to like go see my doctor." They bring it up, that's totally fine. Maybe they say, "Hey, you know what? I'm having trouble with my medication. Like if I could work part-time for a couple days off, like I think I could get it right." Then those are great conversations to have, because now you're having an interactive conversation. And the more a company is willing to essentially accommodate, flex to give that team member what they need to be well and be a great worker, at the end of the day, everybody wins. So I think it's totally acceptable to address performance issues when, especially if we know that there's some underlying challenges that may be contributing to it. But it's very important that we don't lead those conversations with the assumptions and discussing any sort of medical conditions going into it.